Well, here we are. We're back with Dr. T from Ocean in New Jersey. Dr. T, hair removal, as simple as it sounds, doesn't seem to be so simple after all. It just, people seem to have problem really getting it done, and they seem to have wrong expectations of how long it lasts and how permanent it is. Can you tell us a little bit about it?
Yes. Laser hair removal received FDA clearance in this country in 1999. Within that year, we actually got our first device for laser hair removal. I think what people have to realize, the correct term really is permanent hair reduction. If you take any specific area of the skin, can we eliminate every single hair? It would take a large number of treatments to do a complete removal. Most people are satisfied with an 80 to 90% long-term reduction. So most people will pay for a certain number of treatments and get that benefit. Now, if we would double the number of treatments, which obviously would double the cost, then would the patient get an improvement? Absolutely. But you get a little less return on the investment with every future treatment after that. What people need to realize, whenever you see a number of hairs on any particular body part, let's say a woman's concerned about the hair on her upper lip, what you see is only a fraction of all the hairs that are really there. What's happening is you have hairs in a active growing phase, the hairs you see, and there are some that are in the shedding or resting phase, which are hairs you don't see. When a laser fires, it will tackle or disable or permanently eliminate most of the hairs that you see. But those 80% or so that are in the resting or shedding phase are totally invisible to the laser. That's why laser hair removal requires multiple treatments. Now, how many treatments is the next question commonly asked. It really depends on several factors. How dark the skin is a really critical factor. A person of a darker skin type requires more treatments simply because we have to lower the laser energy so we don't burn the skin, and because we lower the energy, they often require more treatments. On average, I would say we'd give anywhere from 4 to 8 treatments, depending on skin type, to achieve a long-term permanent hair reduction on any given area of the body.
I see. And when you say permanent hair reduction, so after that time, does a person have to go and do some type of maintenance plan after a few months or few years again, or a few weeks? What's the deal there?
It really depends on the level of satisfaction and what a patient or client is really trying to achieve. After a course of, let's say, a person is of a fair skin, has dark hair, and we give them the planned 4 treatments. After those 4 treatments, 6 months later, a year later, she will have a little bit of hair growth usually, and for most people they're quite happy, especially if it's in an area like underarms or bikini, where they're finding themselves not having to shave on a regular basis. Now on the face, I find some patients often want further treatments to have even further reduction. What you have to realize, what the laser will do on some hairs, it will permanently disable the hair bulb from ever producing any more hair. Others, the hair bulb will produce finer hair. And in a few hairs, it just doesn't work and they would need more treatments.
Okay, all right. So definitely a big difference between having to shave every day or every week or whatever it might be, a lot, and them being gone. A huge relief.
And the nice thing, unlike electrolysis, which is also another procedure, electrolysis tackles one hair at a time. Laser tackles areas at a time, so it can actually, for the time it takes to do perhaps a dozen hairs on electrolysis, you can tackle several hundred hairs using a laser.
I see. Now, would I have a good business model where I could help a lots of people and make a tremendous amount of money if I just buy a lots of duct tape, put it on, and tear it off? Would I be able to create a lots of patients and money that way?
Well, maybe on a very, very short-term basis. The duct tape or the waxing, what that does, it does remove the hairs, but it does not disable the hair bulb, and of course the hair bulb will produce a new hair. And as a matter of fact, it's a good thing you mentioned about waxing, because for laser hair removal to be most effective, we do ask the client refrain from waxing or plucking for at least 2 weeks. Think about it. If you pluck or wax, you've taken that hair completely out of the hair follicle. How the laser actually works, if we go down to a microscopic level, the darkness of the hair absorbs the laser energy. That energy is translated into heat. That heat is then shifted or transmitted to the hair bulb, and the hair bulb is disabled. If you pull that hair out, that laser energy will go right through that hair follicle, not absorb any energy, and that hair bulb remains intact. Even though that is an active growing hair, if we've plucked it out, we're actually making the laser job impossible.
I see. Okay, wow, that's good information to have. So, but anyway, so as a person comes, if a person did this before and did waxing and using the duct tape type of stuff, that doesn't mean he now ruined future laser treatments, right?
Correct. Now, another thing, a lot of clients will tell me, "Doctor, you mean I have to let this hair grow for 2 weeks? I won't be able to live with myself." And I tell them, there are several things you can do instead of waxing or plucking. You may bleach it. You may clip it, or you may shave it. But what we don't want you to do is to actually pluck or wax. But bleaching does not lessen the effectiveness of laser hair removal, because the bleaching basically lightens the color of the hair from the surface up. It does not affect the darkness of the hair below the skin, and that's where the laser works.
I see. So basically a couple, 2-3 weeks before laser treatment, one shouldn't do the waxing.
Correct, exactly.
Okay. Wonderful information. Thanks a lot.
My pleasure.